Meet Johnny. He's been dreaming of one thing, playing soccer again.
Thank you for coming in today. We just received Johnny's K-level assignment results.
K-level is a medical classification system used primarily in the United States to assess the functional mobility potential of people with lower limb amputations. It helps determine what kind of prosthetic device is appropriate and whether it will be covered by insurance.
Based on my evaluation, unfortunately, your K-level is K0.
What does that mean?
That means that Johnny isn't expected to walk or move around safely, even with help. And even using a prosthetic wouldn't improve his movement or quality of life. So he is not eligible for a prosthesis.
But I've been so excited to finally play soccer with my friends. And now you're saying I can't ever do that?
Dr. Martin, my son works with a physical therapist every day. He's more than capable of using a prosthetic. Isn't that what we're here for?
I'm sorry, sir.
67% of physicians do not believe the K-level system accurately reflects rehab potential. 75% agree that combining physical assessments would improve objectivity, and 47% report they are the sole decision makers in K-level assignment. It's outdated, it lacks nuance, it reduces human potential to a number, between 0 and 4. Because the current K-level system rates patients on their existing ability, not their potential with a better prosthesis, it often denies access to advanced prosthetics, limiting mobility and independence. That's why we're introducing a new P-level system, potential level, shifting focus from current function to growth potential, one that actually reflects what patients can do. This new system combines physical performance with lifestyle goals, letting patients take surveys, do physical tests, and receive an AI-powered data-driven rating. If a patient's condition improves, they can easily retake the assessment anytime, online or in the clinic. Let's measure what really matters, a smarter, fairer future for prosthetic access.
Welcome to our capstone presentation on our e-patient, Joe Riffe. My name is Leo Negrete. I am an incoming senior from Napa, California.
My name is Evan Johnson. I'm an upcoming sophomore from San Jose, California.
My name is Ikchap Bendra. I'm a rising junior and I'm from San Jose, California.
My name's Sage Favento and I'm a rising senior from Vancouver, Canada.
My name is Matthew Sain. I'm a rising senior from San Francisco, California.
My name is Leah Seitz. I'm a rising senior from Greenwich, Connecticut.
Our e-patient Joe fell 110 feet off of a waterfall on May 8, 2011 and chose to have his left knee amputated on January 26, 2012. He is one of the 55 known above-the-knee amputees to return to work as a paramedic on an ambulance. He began a campaign to pass an Insurance Fairness Act nationally to ensure that all amputees can receive the best prosthetic for their lifestyle and allow them to return to a high quality of life. His doctor had declined his request since his leg still had a pulse and was healthy. Since his request was declined, he resorted to getting support from social media.
During our initial interview with Joe, we learned many things about the subject of amputation, but the most important things were that the impact of amputation on a person's life is not just on physical health, but also mental health. Many amputees struggle with body dysmorphia and need a way to accept their new body image. Also, the prosthetic Joe has takes a while to put on, which causes him to run late for work. Lastly, he had to battle with his insurance company to get his prosthetic leg in the first place because of the current K scale.
In the process of creating our final How Might We statement, we started by laying out the group of people we wanted to help and how we wanted to do it. For example, teen amputees and providing them with more supportive resources. From there, we diverged into two different possible solutions. The first idea aimed to improve the support and mentorship groups that already existed but aren't very effective. The second idea was meant to expand upon the process used to evaluate amputees when getting their prosthetics to make it more impartial and fair.
Our team explored the core challenges that amputees face on a daily basis, physically, emotionally, and systemically, and we identified 3 key areas for innovation. Our first concept focused on making prosthetics customizable, using stickers, art, and theme wraps to help reduce stigma, boost confidence, and turn a daunting device into a fun form of self-expression. The second idea was an online mental health support group for amputees. While some exist, we emphasize the emotional difficulty of accepting disability. As Joe shared, it took him 2 years to fully come to terms with it. Our last concept is the one we decided to implement, which is aiming to reform the outdated K0 to K4 prosthetic eligibility scale.
Once we came up with our initial concepts, we got feedback from Joe for thoughts on our ideas. He was very interested in the improved K scale, which we are calling the P scale. His ideas were to consider the patient's activity in more detail on what their jobs require them to do, like using smartwatches for how many steps they take a day. He also recommended having multiple kinds of doctors come together to make the classification to have a more diverse perspective and eliminate bias. He said that the patient's BMI should not factor into the decision since it isn't a good indicator of how active a person is. Joe said that in many of the Facebook groups he's in, most people join just to harass and objectify the amputees in it, since it's hard to create a safe space that's accessible to amputees.
And now, Moving on to our final solution, we changed from K-level classification because it is outdated and the decision for the patient is solely dependent on their physician. However, in P-level classification, a survey is completed by the patient, physician, psychiatrist, and even physical therapist to help determine classification. In addition to the questions, fitness and movement data will be gathered from a wearable Garmin watch. The patient's physician, psychiatrist, physical therapist, and mentor or advocate meet as a committee to decide the patient's classification. And if the patient does not agree with the classification, they can always appeal it.
The following are survey questions for healthcare professionals working closely with amputees. By gathering input from multiple professionals, the process is more objective and comprehensive, helping the committee make a well-rounded decision about classification. These survey questions are for amputees themselves, giving them a voice in the process. By including patient perspective, the classification is more personalized and meaningful, ensuring that recommendations truly reflect the patient's needs and goals.